when is maybe a time the doctor might decide, all right, we need to get you into the hospital. You need to actually stay in the hospital. So, Dr. Barrocas, maybe you can tell us about when is hospitalization actually necessary for someone suffering from pneumonia?
Well, we have various criteria. It depends on a couple of things. One is age, so anyone over 65 is considered for hospitalization. However, they have to have other criteria, including, but not limited to, confusion, an increased respiratory rate, so you're breathing faster, way faster, or your blood pressures are lower than normal. So those are criteria that we use to admit someone into the hospital.
Okay, and once they are there, as far as the treatments go, I know you've both mentioned that you don't treat viral infections with an antibiotic, but if you're in the hospital, what kind of treatment might you be receiving? Is it intravenous fluids, or what might be happening if you're actually going to be in the hospital for a couple of days because you have pneumonia?
Yes, well, it definitely depends on the kind of pneumonia because there are different types, but mostly people get IV antibiotics, nebulized treatments to kind of help with the breathing situation, antipyretics like Tylenol or ibuprofen as needed to help with any fevers that might develop, cough medication to help with the coughing. So it's just a lot of symptomatic treatment, and definitely the antibiotics targeted towards the infection of the pneumonia.
Additionally, we'll provide with oxygen. It depends on how severe their symptoms are. Sometimes we'll do it via nasal cannula. Other times we'll use something called a venti mask, which delivers quite a bit more oxygen. And we'll go all the way in terms of non-invasive ventilation to help expand the lungs, or even intubation if it's severe enough. In addition to that, we would use bronchodilators. Basically, it's nebulizer treatments that open up the airway. And of course, we'll always treat the chronic health conditions, including chronic obstructive pulmonary disease. We'll sometimes have excessive wheezing because there's already inflammation in that bronchial tree. And therefore, we'll add a steroid IV, which will help quite a bit.